Foundations for Mental Health Nursing. Chapter 1. Basic Mental Health Nursing Concepts. Provision of care to clients in mental health settings is based on standards of care set by the American Nurses Association, the American Psychiatric Nurses Association, and the International Society of Psychiatric Mental Health Nurses. Nurses working in mental health settings should use the nursing process, as well as a holistic approach, biological, social, psychological, and spiritual aspects, to care for clients. Nurses should use various methods to collect data from clients. These methods include observation, interviewing, physical examination, and collaboration. Data collection. Perform physical data collection as indicated for client condition or policy. Use touch to communicate caring as appropriate. However, respect the client's personal space if they do not wish to be touched. Be sure to include questions relating to difficulty sleeping, incontinence, falls or other injuries, depression, dizziness, and loss of energy. Include the family and significant others as appropriate. Obtain a detailed medication history. Following the interview, summarize and ask for feedback from the client. Each encounter with the client involves an ongoing data collection. Psychosocial history. Determine the client's perception of own health, beliefs about illness and wellness. Activity/leisure activities, how the client passes time. Determine the client's use of substances and any history of a substance use disorder. Determine the client's stress level and coping abilities, usual coping strategies, support systems. Cultural beliefs and practices. Identify the client's cultural healthcare beliefs, practices, and values. Determine cultural factors that can impact the client's care. For example, does the client's diet consist of culture-specific foods? Does the client have specific beliefs or practices regarding healthcare? How is the client's diagnosis viewed in their culture? The nurse's awareness of culture alleviates stereotyping and stigmatizing. Use a trained interpreter when needed. Spiritual and religious beliefs. Spiritual and religious beliefs affect the way in which a client finds meaning, hope, purpose, and a sense of peace. Spirituality refers to a client's internal values, sense of morality, and how the client views the purpose of life. The client might not connect these spiritual views with religion. Religion refers to a client's beliefs according to an organized set of patterns of worship and rituals. Determine the client's support systems and assist the client to identify support persons and resources. Mental Status Examination, MSE. Level of consciousness. The level of consciousness is described using the following terms. Observed behaviors are included in the documentation. Alert. The client is responsive and able to fully respond by opening their eyes and responding to a normal tone of voice and speech. The client answers questions spontaneously and appropriately. Lethargic. The client is able to open their eyes and respond but is drowsy and falls asleep readily. Stuporous. The client requires vigorous or painful stimuli, pinching a tendon or rubbing the sternum, to elicit a brief response. The client might not be able to respond verbally. Comatose. The client is unconscious and does not respond to painful stimuli. Abnormal posturing in the client who is comatose. Decorticate rigidity, flexion and internal rotation of upper extremity joints and legs. Decerebrate rigidity, neck and elbow extension, wrist and finger flexion. Physical appearance. Examination includes data collection of personal hygiene, grooming, nutritional status, clothing choice, and whether the client looks older than their stated age. Expected findings with regard to this data are that the client is well kempt, clean, and dressed appropriately for the given environment. Behavior. Examination includes data collection of voluntary and involuntary body movements, and eye contact. Mood. A client's mood provides information about the emotion that the client is feeling. Affect. A client's affect is an objective expression of mood, a flat affect or a lack of facial expression. Cognitive and intellectual abilities. Determine the client's orientation to time, person, and place. Check the client's memory, both recent and remote. Immediate, ask the client to repeat a series of numbers or a list of objects. Recent, ask the client to recall recent events, visitors from the current day, or the purpose of the current mental health appointment or admission. Remote, ask the client to state a fact from their past that is verifiable, their birth date or their mother's maiden name. Identify the client's level of knowledge. For example, ask the client what they know about their current illness or hospitalization. Check the client's ability to calculate. For example, can the client count backward from 100 in serials of 7? Determine the client's ability to think abstractly. For example, can the client interpret a cliché, a bird in the hand is worth two in the bush? The ability to interpret this demonstrates a higher level thought process. Perform objective data collection of the client's perception of his illness. Determine the client's judgment based on the client's answer to a hypothetical question. For example, how would they answer the question, "What would you do if there were a fire in your room?" The client should provide a logical response. Check the client's rate and volume of speech, as well as the quality of their language. The client's speech and responses should be meaningful, articulate, and appropriate. Standardized screening tools. There are a number of standardized rating scales that can be used for evaluation and monitoring of clients. Mini Mental State Examination, MMSE. This examination is used to objectively collect data about a client's cognitive status by evaluating the following: orientation to time and place, attention span and ability to calculate by counting backward by 7, registration and recalling of objects, language, including naming of objects, following of commands, and ability to write. Pain data collection tools. Pain rating tools include visual analog scales, Wong-Baker Faces Pain Rating Scale, the Faces Pain Scale Revised, the McGill Pain Questionnaire, MPQ, and the Pain Assessment in Advanced Dementia, PainAid, Scale. Considerations across the lifespan. Children and adolescents. Data collection includes temperament, social and environmental factors, cultural and religious concerns, and developmental level. The client should be the source of the information, but with children and adolescents, caregivers can also provide valuable information. Mentally healthy children and adolescents trust others, view the world as safe, accurately interpret their environments, master developmental tasks, and use appropriate coping skills. Children and adolescents experience some of the same mental health problems as adults. Mental health and developmental disorders are not always easily diagnosed, potentially resulting in delayed or inadequate treatment interventions. Factors contributing to this include the following: lack of the ability or necessary skills to describe what is happening, a wide variation of normal behavior, especially in different developmental stages. Check for mood, anxiety, developmental, behavioral, and eating disorders, and risk for self-injury or suicide. Use the HEDS's standardized data collection tool. Home environment. What is the client's relationship like with their guardians and other family members living in the home? Education/employment. Is the client employed? How is the client's school performance? Activities. Does the client participate in sports or other activities? How does the client interact with peers? Drug and substance use. Does the client use substances, alcohol, tobacco, or illicit drugs? Sexuality. Has the client engaged in any sexual activity or had any sexual encounters? Suicide/depression. Is the client at risk for suicide or self-injury? Does the client have indications of depression? Safety. Is the client exposed to abuse in the home or violence in the neighborhood? Older adults. In addition to the aforementioned data collection, a comprehensive evaluation of the older adult client includes the following: functional ability, the ability to independently get dressed or manage household tasks. Economic and social status. Environmental factors, stairways in the home, that can affect the client's well-being and lifestyle. Standardized data collection tools that are appropriate for the older adult population include the following: Geriatric Depression Scale, short form, Michigan Alcoholism Screening Test, Geriatric Version. MMSE. Conduct an interview of all clients in the following manner. Use a private, quiet space with adequate lighting to accommodate for impaired vision and hearing. Make an introduction, and determine the client's name preference. Stand or sit at the client's level to conduct the interview, rather than standing over a client who is lying in bed or sitting in a chair. Mental health diagnoses. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, published by the American Psychiatric Association, is used by mental health professionals to diagnose mental health disorders in clients following standard criteria. It includes expected data collection findings for disorders and helps with planning, implementing, and evaluating care. Nurses use diagnoses from the North American Nursing Diagnosis Association, NANDA, to provide the basis of appropriate nursing interventions for clients. Serious mental illness includes disorders classified as severe and persistent mental illnesses. Clients often have difficulty with activities of daily living, ADLS. Are lifelong disorders that can have remissions and exacerbations. Role and life changes. Role transitions include loss of employment, divorce, retirement, grandparenthood, widowhood, death of guardian, and becoming a caregiver or recipient of care. Some role changes are predicted, an upcoming retirement. However, the client might find that others are unexpected, becoming the recipient of care due to a sudden illness or injury. Identifying the client's ability to adapt and cope includes the following: health status and functional abilities, living arrangements and employability, personality factors, such as attitudes, client, caregiver, and family observations, levels of information, such as community programs, medication use and supplemental services. Evaluating whether client has successfully adapted includes the following: able to state positive coping behaviors, able to identify maladaptive coping behaviors, able to participate in community resources, able to list stress reduction techniques, able to maintain housing and employment. Therapeutic strategies in the mental health setting. Counseling. Using therapeutic communication skills. Assisting with problem solving. Crisis intervention. Stress management. Milieu therapy. Orienting the client to the physical setting. Identifying rules and boundaries of the setting. Ensuring a safe environment for the client. Assisting the client to participate in appropriate activities. Promotion of self-care activities. Offering assistance with self-care tasks. Allowing time for the client to complete self-care tasks. Setting incentives to promote client self-care. Psychobiological interventions. Administering prescribed medications. Reinforcing teaching to the client/family about medications. Monitoring for adverse effects and effectiveness of pharmacological therapy. Cognitive and behavioral therapies. Modeling. Operant conditioning. Systematic desensitization. Health teaching, reinforcing teaching social and coping skills, as well as stress reduction. Techniques. Health promotion and health maintenance. Assisting the client with cessation of smoking. Monitoring other health conditions. Case management, coordinating holistic care to include medical, mental health, and social services.